All right, now this is the last section of transport phenomena in biological systems. Here I want to discuss a few examples of transport processes in disease pathology and treatment issue. I believe this transport is such an important in our physiology that if there's something wrong or the pathology is very related to this transport phenomena. And even our treatment strategy is also very important. And this transport phenomena is based on engineering approach. So we need to understand this to come up with a better treatment or understanding of this disease process. So first, an example as a atherosclerosis, which is a disease of middle or large sized elastic and muscular arteries. And when fully developed, the lesions will protrude into the lumen of the artery. Of course, that will reduce the blood flow because of the increase of resistance, as we understand the relationship of this pi flow. The resistance to the fourth is resistance is related to the 1 over the radius to the fourth. And that's, I think here is described as there's a flow and there's a lesion, so-called a plaque, atherosclerotic plaque, and that will narrow down this blood vessel, especially artery. And when it becomes a problem is when this so-called vulnerable plaque will rupture, and that will expose and generate a blood clot. So plaques forming and plaques grow, and eventually if it ruptures, then blood clot forms, and it will limit the flow. In bad case, it will block the vessel. And what happens if it happens to be on top, the feeding vessel to the heart downstream tissue will die, and that's called myocardial infarction. So this reducing blood flow to tissue downstream or causing platelets to adhere this arterial wall, and that results in the inside to blood clot, or called thrombosis. Or when it becomes a traveling clot, it's called embolism, that can lodge into the lung, causing emphysema, and or it can lodge into the brain. It can cause a ischemic stroke. So that's a big problem. And here I put a real sample with a stain, so you can see this narrowed artery, so causes atherosclerosis. And also this pathological picture is from aorta. So aorta developing artery atherosclerosis. You can see the lesions here. The surface is not smooth at all. And sometimes this carotid artery, when it develops this atherosclerotic plaque, and that causes a turbulent flow. So when this flow happens, this turbulent flow causes a sound, a specific sound called a bruit. So we can use it as a diagnostic clue. And of course, these can lead to heart attack or heart failure, or when it becomes brain, and stroke can happen. So I want to discuss about cancer related to cancer, so which will be topic for the next time. So in general, when there is a cancer, we have about 3 kinds of treatment. First is a radiation therapy. The second is first a surgical resection, surgically remove the tumor out. And the second is a radiation to target specific for highly proliferative cancer cells. And lastly, a chemotherapy. So here, surgery and radiation is when the patient have a few large tumors in the body, then we can identify, we can surgically resect, or before or after we can use ionizing radiation to try to kill and reduce the tumor mass. Or after surgery, we try to kill the remnant tumor by using radiation. but those may not be complete, and typically it follows with a chemotherapy drug, and that chemical drug which usually targets for rapidly proliferating cancer cells, and this is a systemic therapy. And the problem so far is we can cure or kill cancer cells in vitro experiment. The problem is in the real patient, it doesn't happen that way always. And one part of the issue is because of the drug delivery. So how to deliver anti-cancer agents to tumor is a very important engineering aspect of the problem. And I bring 3 movies, which from my research, I took these 3 pictures, and let's discuss what it is. So the left part of this is there's a tumor one side, and the other part, so-called more normal side. And this black dots inside the vessel is in fact red blood cell. So you can see these red blood cells move very smoothly, and you can see it's well perfused. While this part is lower part, the green is actually tumor cells. So this is a tumor boundary. So let's see how the flow looks like. So you see those flows kind of okay, but in here, it's much slower and intermittent flow, while the other part looks quite okay. And what happens when we were totally inside the tumor? The blood vessel diameter is comparable to the normal side one. However, when you look at the flow, let me show you here. It's much slower, so the perfusion doesn't do very well. And you see these dots stops. What that means is, and some part of this tumor, the vessel perfusion kind of stops, which means our drug will not pass through. So the problem is in the cancers, even single cancer cells can remain and proliferate again to recur the tumor, and which can be a big problem. It can, so you see, even if we give our drug orally or even intravenously, if this drug delivery is through our circulation and the circulation doesn't work inside the cancer, we've got an issue. So the delivery is a very important issue, and efficiency of our delivery depends on physical and chemical property of therapeutic agents and the tumor microenvironment. So, so understanding this is very important to when we try to actually treat a patient tumor. And as an example of therapeutic agents, so what's necessary in our treatment? So for example, radiation therapy requires an oxygen for generating reactive oxygen species to kill the tumor cells. The problem you see previously, inside the tumor, some part of the tumor may not be well perfused. That means oxygen delivery is not good enough in that area, such that even radiation therapy may not be effective in that part of a poorly perfused part. So it becomes a problem. And chemotherapy, we use cytotoxic drugs, which targets proliferating tumor. But if the drug cannot get into the tumor properly, that's a problem. And we have some of another therapeutic agents as so-called photodynamic therapy, which utilize photosensitizers, which hopefully get well into the tumor, and we use a light to activate this photosensitizer to be toxic locally to the tumor. Or in gene therapy, viral or non-viral vectors has to be delivered to those problematic cells which needs a genetic modification. So this delivery is again an issue, and immunotherapy, a vaccine or effector cell delivery to the right location would be an issue. So transport processes has to be considered when we consider the delivery of these kinds of therapeutic agents. So we need to understand, let's say, the tumor microenvironment, fast circulation, so circulation into the tumor. And when there's a vessel, and the vessel may not be the same as healthy, normal physiological vessel. So the transport across the vessel of the drug agent is important. So we can call transvascular transport has to be considered. What about the therapeutic agents pass out of the vessel? Then it will be in the interstitial space. It has to move on towards the cancer cells. So interstitial fluid flow or interstitial transport becomes very important. And now it gets into the tumor cells, and the transport across the tumor cell plasma membrane will be also, again, important. And once it gets inside the cell, intracellular transport. So you look at these multiple layers of transport, layers or hurdles for effective transport of therapeutic agent to really take effect to the cancer cells. So that's such an important issue we can think of for practical therapy. So now let's summarize our transport phenomena in biological system. So we understand the importance of these transport processes in biological system, both in normal physiology and in pathology. And especially diffusion at the micro and macroscopic point of view, understanding is very important. And the analytic tool for understanding this, we introduce random walks and fix first law and second law to describe this diffusion as a physical mathematical equation. And also we discuss about the importance of length scale compared to diffusion versus convection, because we realize diffusion is very efficient at a shorter length scale, while the bigger length scale, diffusion is not effective anymore because it's the diffusion distance is twice, then the length time will be a square of it. So we developed a multicellular bigger size organism, develop a convection system, which is represented as a cardiovascular, respiratory system, and that's using convection, a bulk motion of our fluid or gases to deliver these molecular for exchange. And in the end, transporting across the cell membrane and among cells are important, and that leads to our physiological transport. And it's even also very important to understand disease physiology and treatment. And I hope this lecture will give you an idea how important to physical and engineering understanding of transport phenomena for understanding the biological system and later on the disease pathology. And thank you very much for your attention.